Can hepatitis B be transmitted through saliva? I'm Dr. Bhargav Raut from Pathofast Lab, Pune. We perform a lot of blood tests for hepatitis B, and I'm going to tell you whether this is possible and what are the risks. Hepatitis B is a virus that spreads through body fluids like blood, semen, urine. It may be present in very small quantities in breast milk, vaginal secretions, and in extremely small amounts in saliva. Saliva is not considered to be a very prominent vector for transmission of hepatitis B. It's not like in the top 5 fluids that we think of when we consider hepatitis B transmission. The only situation in which you need to worry about whether saliva will transmit this infection, whether you can get this by coming in contact with someone's saliva, supposing that the person does have hepatitis B, depends on a couple of factors. So first of all, it depends on how well the virus is replicating in that person's body. Hepatitis B can exist as a carrier in someone's body without really being present in large amounts in any body fluid. It could just be there in the liver. So these people are called carriers because they don't show active replication of hepatitis B, but it is still there somewhere in their body. So in which stage of replication is the virus in the body of the person whose saliva you have come in contact with is very important. This is also called viral load, but obviously that's a little difficult to know if what is the state of that person's hepatitis B viral load or replication. Be that as it may, the second most important factor is whether that saliva is also contaminated with that person's blood. So imagine that there is someone who has a lot of sores inside their mouth. They have some bleeding gums. They have ulcers inside their mouth, under the tongue, on the lips, which are open, actively bleeding. Now that blood can get into the saliva, and in that case, that saliva could become a more potent way of transmitting this infection. So if there is blood mixed with the saliva, you need to be more cautious, and it could possibly lead to a transmission, although the risk is still very low. The third situation is whether there has been intimate contact. By this we mean whether your lips, your tongue has come directly in contact with the saliva and blood mixed with it, and whether you also have an open cut or a wound somewhere in your mouth, on your gums, on your tongue, on the inner side of your cheek. If your blood is also open and in contact directly with that saliva, this will further increase the chances of transmission. So it depends on what is the viral load in the person who has the hepatitis B whose saliva you've come in contact with. Second, whether there was blood mixed with that saliva. And third, whether your blood or mucous membranes have come in direct contact. For example, if the saliva falls on your skin is impervious. It is you can't get saliva falling on the skin of your arm, for example, and transmitting the hepatitis B inside. But mucous membranes, like for example your eyes or inside your mouth, they are permeable. They can transmit the virus directly through that. So what part of your body has come in contact with the saliva is also very important. But all that said and done, saliva is not a very prominent mode of transmission, and you shouldn't be too worried. The best option is get yourself tested, get a HBsAg test done after 6 weeks, or if you're even more worried, you can go for a HBV DNA test after about 3 weeks. But that's all that you need to be thinking about in terms of hepatitis B spreading through saliva.